Week number 5, lecture number 5. Hello friends. So this is basically the week number 5 and we are talking about stress and burnout management techniques. So far we just saw that what is stress, what is burnout, and how health professionals suffer through all these things. Certain ways to manage stress, all those lessons we learnt. Now in this lesson we are just talking about avoiding burnout. Firstly, we will see what is and what types of burnouts are there, and thereafter we will just see how to cope up with that burnout. There are 3 coping mechanisms as well as there are 3 intervention mechanisms. So this is what we will see in this lecture. To understand the concept of burnout, we have seen it, but we will just repeat it. Repetition is very good, particularly for distance learning. Sources of stress to determine coping behavior and possible interventions. Understand the importance of burnout in physicians. Be aware of symptoms of burnout, be able to determine sources of stress and be aware of intervention approaches. We know practice of medicine is very stressful, and in one of our lectures we spoke about compassionate fatigue, because doctors always listen to the traumatic stories of patients every day for so many years altogether, and that is how they produce secondary traumatic stress, and that is what we call compassionate fatigue. Physicians must interact with intense emotional aspects of life. Physicians are called on to cope and adapt with stress characteristics of their job. Physicians must continuously respond to the needs of patients and families and expend their own emotional resources to provide care and caring to others. This is what they have taken oath for while graduating from medical college. Medical encounters are often stressful, and the physician must reach deep within him or herself to give to those unable to give back or express gratitude. Patients and societal expectations demand certainty from the medical profession, while medical knowledge includes limitation and uncertainty. Doctors can't give you guarantee. Doctors cannot give you guarantee that by this particular method or this medications or this treatment the things will go well. No, it is just not possible. They are also trying to that based of ability and knowledge. They are giving you the best medicines which they trust. But to get well, to get okay, it is just not in their hand, and we in society, we people in society, we think and we demand that doctors should be able to give us the guarantee, because we pay the fees and they must give us the health. Physicians every day are called on to cope and adapt with stress characteristics of their role. Intense withdrawal of emotional reserves is required, while emotional deposits may be infrequent and very few. For some, coping capabilities prove insufficient and emotional reserves become depleted. For these, burnout becomes a reality for doctors. Why this topic? Some of the points are equally good, equally applicable to other jobs also, which are demanding in nature. Demands of the job as a doctor, but there are also external factors. First factor is demand of a job as a doctor, because they are there to help the patients. This is their first and foremost priority. There are other factors also that cause doctors to stress out. They are giving all day and night emotionally and dealing with physical and emotional distress, but who cares for them? Is there any gratitude that they are working for us? When you call, emergency call is there during night and a doctor will rush out from his or her bed and will just come to the hospital to treat you. Where is the gratitude for such work? For general practitioners in particular, there is isolation, both physiological and physically. Doctors are also practicing intensively at front line. Long hours lead to poor family relationship support. Lack of feedback. I do not remember that after getting well and going back, any patient has written a thank you letter or thank you card to a doctor. You ask yourself, you thousands of people are listening to me now, and I am telling you, have you ever said a word of thanks even on telephone to your doctor when he treats you and recovery happens and you are happy again? They do not get a feedback. What they get, instead of a proper positive feedback, they get complaints, medical legal problems. Perceived threat of, for example, violence. Nowadays it has started happening. Patients relatives become rude, violent. They attack the hospital premises, doctors, nurses. Insecurity, poor support from management, poor practice, pressure from seniors. These are the demands on a doctor, and that is why they come under stress that leads to burnout. Importance of avoiding burnout. Burnout in physician has many important implications for persons experiencing it as well as the recipients of healthcare. Knowledge on how stress and burnout develops is very important. This understanding will help how to prevent burnout. It's a concept very old, little collapse of the human spirit. Burnout means it's a collapse. You don't have any interest, you become lifeless, you don't have any purpose, don't have any goal in the life, you think everything is over now, that is burnout. You are living, but you are dead. It's a psychological withdrawal from work in response to excessive stress and dissatisfaction. And here I will add another word, it is withdrawal not only from work, later on you withdraw from your own life also when you enter into a state of depression. It's an emotional state that may be accompanied by a number of physical and behavioral changes. It is also described as the extent to which a worker has become separated or withdrawn from the original meaning and purpose of his work, and that was to help the society in matters of health, prevention and treatment of disease. What were the sources? Senior doctors, basically we are talking about senior doctors, they work faster and longer hours, mountains of paperwork and threat of malpractice suits. Economic security also proves elusive sometimes. How much they can work, how much money they can amass after all. Resident doctors, long training hours, excessive workloads, sleep deprivation because they are in the hospital and they are the first responder to any call from the nurse, from any ward. Changing work conditions, peer competition, it is always there in any field, and self-denial, because you have to deny so many good things to yourself. Now this thing leads to burnout, difficulties to keep up to date, challenge to explain and defend work, and daily confrontation with sickness and death. When the whole environment and profession demands that only you will remain with a sick person. Degrees of burnout, there are 3 degrees. First degree, failures to keep up and gradual loss of reality. First degree, it can be managed, there is just no problem. Second degree, accelerated physical and emotional deterioration. Now it requires heavy effort to come back to the normal situation, because earlier you are not looking at the reality, but now it has gone deeper, physical and emotional things. And third degree, major physical and psychological breakdown, and that can lead to depression. 5 stages of disillusionment. The degree you wanted the most when you are a student, you worked so hard, gave the competitive examination, got a merit, got admitted in the hospital. You love that particular work of being a doctor. You are happy and you are proud that you are a doctor now, MBBS degree. And after few years, this is what is happening to you. There are 5 stages of disillusionment. The work which you cherished, you worked so hard to achieve, and now the same work has produced this burnout, and you are disillusioned totally. You don't like this now. Enthusiasm is gone. You are not ready. That continuous medical education, that improvement for patient and doctor's relationship, that is totally gone. Stagnation, because now you don't keep up yourself medically. Medical knowledge is advancing very fast. Frustration, because of these two, people don't believe you. They say now you are outdated. You get frustrated. Apathy towards you and toward the patient. And lastly, intervention needs to take place at any stage to prevent burnout. These are the 5 stages. If you do something in the first stage where your enthusiasm is lessened in this profession, do something. Then you can come out. Stagnation, you are still working, but you don't want to proceed further. You have become a doctor, but you don't want to go for MD, because again it requires lots of competition. You don't want to advance in your profession. This brings frustration, and when frustration comes, your effectiveness as a doctor goes down. Apathy, you cannot defend against this frustration, and apathy, theek hai, chalne do, let it go like this, Interventions need to occur. Intervention can occur at any time. Now for this we will just see 3 coping mechanisms as well as 3 intervention mechanisms. The transactional model of burnout, stage 1 demands, it's a similar thing what we spoke about in the lecture of stress and burnout. I gave you a simple model, demands and resources. When demands are increasing and resources are decreasing, the stress occurs. Here in the stage 1, demands exceeding emotional resources. Stage 2, attempts to balance between demands and resources. He is trying, after all he is a knowledgeable guy, he is a doctor. He is not a buffoon, very intelligent guy. So he tries to balance between these two. But nothing happens. He could not balance, and then he enters into the 3rd stage, that is maladaptive coping mechanism. This is the stage 3 burnout. Response is physical, and this maladaptive coping mechanism. This is the adaptive coping mechanism where balance is restored and responses are resolved. Stage 3 burnout, cynicism, negativism, altered work patterns, family conflicts also. Earlier he was earning so much, family was very happy, comfortable. Income has gone down, family is unhappy. Uncontrolled crying, excessive death thoughts, substance abuse for a doctor it is easy to get drugs, control drugs, because he is a doctor. So, this is what happens in stage 3 burnout. We can have adaptive coping mechanism, learn and apply principles of stress management, participate in support groups, seek appropriate substance abuse treatment, seek appropriate family therapy. Response is balance restored and response is restored. Coping behavior 1, working harder and longer, sense of entitlement, belief on immunity to difficulties, and failure of self-recognition of mental problems. This is very easy coping behavior which he has to undergo. Coping behavior 2, alienating family members and friends. 3 primary explanations for alienating family members and friends have been proposed: anger and frustration, fearing breach of confidentiality, and familiar friends may be perceived as another source of potential demands. Anger and frustration are vented to family and friends. Inability to share troublesome experiences and family and friends are another source of demand. Coping behavior 3, avoiding to be with the family. The physician dweller spends excessive time socializing around and therefore has to stay late to get all work done. Electronic physician arranges to be available for patient 24 a day, 7 days a week. So he gets stressed. Out of town academician must accept every invitation that comes along, conference, lecture, this or that. This is how he avoids family by means of these 3 things. Let us talk about intervention 1. Initiation of programs to alert physicians to stresses. Certain programs need to be initiated either by the department or by the physician himself. There are so many programs available now in the market. Re-evaluation and restructuring medical training. This is what is required in medical colleges. We do not have certain useful programs to be taught to the students, and this should be in medical colleges. Like earlier I told you, they should be taught about communications, ethics and other things. Similarly, they should be taught properly as a matter of assignment that how they can avoid stress and burnout as a doctor. Offering programs and conferences dealing with burnout. This is intervention 1 just on the academic platform. Intervention 2, learning of new adaptive coping mechanism, self-assessment and determination of stressors, specification of life priorities. That is very important. Earlier you had the priorities of being a doctor, looking after the patients in the hospital. So, this is how you landed in stress and burnout. Now, this is the time to relocate priorities. Families, friends also come. So, let them have their share and reduce the load of work in your private life, sharing and expressing feeling. Intervention 3, alleviating stress at work. At workplace also, reduce the stress, let the workplace be friendly, focusing on positive aspects and small success, setting daily and weekly goals, breaks and variation in daily schedule should be there. This will give you some rest and ruku. Utilizing a team approach. I said earlier, team means you have got a power, authority to delegate, and when you delegate, your own responsibility gets reduced. Delegation does not mean that you have given away everything. When you delegate something, coach the people, train the person that yes, this is how it is to be done, and if you find any problem, please come and contact me. But overall responsibility of doing this work is yours. Contact me when you find some problem. Delegation is very important in such matters, but before you delegate, you have to train your people. Like being a doctor, if you delegate certain responsibilities to your matron or to your chief nurse, it is your duty to train that nurse to that particular level of work. Then only she can perform those tasks. Stress reduction strategies, action strategies, physical change, assertiveness, time management, problem solving, and living the situation. Live it, nothing will happen. If you are not there, then also the world will go on. Thinking strategies, reframing about the situation, about yourself. Normally what happens most of the time, we think this bottle is half, but very few people think that this bottle is half full. We are always in that concept of half empty and half half full. We should remain in that concept, positive concept, that everything has positivity around it. We need to change our goggles, change our lenses to see that positivity, and that is called reframing. Modify your beliefs, thought stopping, and realistic expectation from your work and life. Self-management, exercise regularly, relaxation techniques include meditation and pranayama also. Time outs you must have. All work and no fun, that is very bad for your health. More sleep and rest, social support, humors very important. And humors come and go, and therefore you remain joyful, smile, meditation, living in the nature. These are the self-management techniques, and really they are very, very useful, very powerful also. I have experienced most of these techniques, and I am doing it myself. Conclusion: burnout among physicians is a serious problem with a risk for suicide. Programs and conferences are needed to alert physicians against burnout. Medical training should be re-evaluated and restructured to prevent burnout, and physicians suffering a burnout need to learn new adaptive coping mechanism. And this is equally applicable to any person who is working in any other field. Stress and burnout is anywhere, everywhere, from child to the elderly, or anybody from peon to the Prime Minister. So most of the techniques what we have discussed about, with slight modification, they are applicable in any other field also. Thank you. Thank you, friends.